HASHIMOTO'S thyroiditis is an autoimmune disorder Look at this picture shows that normal thyroid and HASHIMOTO'S ultrasound findings. Look at this detail going on. Introduction. HASHIMOTO'S thyroiditis, also known as chronic lymphocytic thyroiditis, is an autoimmune disorder that affects the thyroid gland. It is one of the most common causes of hypothyroidism, where the thyroid gland does not produce enough thyroid hormones. Definition. HASHIMOTO'S thyroiditis is defined as an autoimmune condition in which the body's immune system attacks the thyroid gland, leading to inflammation and impaired function of gland. Over time, this can result in decreased production of thyroid hormones. Types. HASHIMOTO thyroiditis is primarily categorized as 1. Classic HASHIMOTO'S thyroiditis, characterized by goiter, enlargement of the thyroid gland, and hypothyroidism. 2. Atrophic thyroiditis, a variant where the thyroid gland shrinks over time, leading to a reduction in thyroid hormone production without significant goiter formation. Causes. Exact cause of HASHIMOTO'S thyroiditis is not well understood, but it is believed to involve a combination of genetic and environmental factors. Potential causes include 1. Genetic predisposition, 2. Environmental triggers, example infections, 3. Hormonal changes, 4. Excessive iodine intake, 5. Radiation exposure. Risk factors. Several factors increase the risk of developing HASHIMOTO'S thyroiditis. 1. Family history of thyroid or autoimmune diseases. 2. Female gender. Women are more affected than men. 3. Age. Most common occurs in middle-aged individuals. 4. Other autoimmune disorders, example type 1 diabetes, rheumatoid arthritis. 5. High iodine intake. Complications. If left untreated, HASHIMOTO'S thyroiditis can lead to several complications. 1. Goiter, enlargement of the thyroid gland. 2. Heart problems, increased risk of heart diseases and heart failure. 3. Mental health issues, depression and cognitive impairment. 4. Myxedema, severe hypothyroidism, potentially life-threatening. 5. Birth defects, increased risk during pregnancy. Pathophysiology. In HASHIMOTO'S thyroiditis, the immune system produces antibodies that attack thyroid proteins such as thyroid peroxidase, TPO, and thyroglobulin. This leads to inflammation and gradual destruction of thyroid tissue, resulting in decreased production of thyroid hormones, thyroxine, T4, and triiodothyronine, T3. Signs and symptoms. 1. Fatigue. 2. Weight gain. 3. Cold intolerance. 4. Dry skin and hair. 5. Constipation. 6. Muscle weakness. 7. Joint pain. 8. Depression. 9. Slow heart rate, bradycardia. 10. Memory issues. 11. Enlarged thyroid gland, goiter. Diagnosis. Diagnosis of HASHIMOTO'S thyroiditis involves a combination of clinical evaluation and laboratory tests. 1. Thyroid function test. Measure levels of thyroid hormones T3 and T4 and thyroid stimulating hormones TSH. 3. Antibody test. Detect antibodies against TPO and thyroglobulin. 4. Ultrasound. Assess the structure of the thyroid gland. 5. Fine needle aspiration biopsy. Elevate thyroid tissue if needed. Nursing diagnosis. Common nursing diagnoses for patients with HASHIMOTO'S thyroiditis include 1. Fatigue related to hypothyroidism. 2. Risk for altered body temperature. 3. Risk for impaired skin integrity. 4. Risk for constipation. 5. Anxiety related to chronic illness. Management. Medical management. Thyroid hormone replacement therapy. Levothyroxine is the standard treatment to normalize thyroid hormone levels. Monitoring. Regular blood tests to monitor thyroid function and adjust medication dose. Nursing management. Educate patients about the condition and treatment regime. Monitor vital signs and symptoms of hypothyroidism. Encourage a balanced diet and regular exercise. Provide support for managing fatigue and mental health. Treatment. First treatment option, thyroid hormone replacement therapy, levothyroxine, synthetic T4. 2. Monitoring and follow-up, regular blood test, symptom assessment, 3. Addressing specific symptoms, fatigue, weight management, mental health. 4. Diet and lifestyle modifications, iodine intake, gluten-free diet, balanced diet. 5. Addressing coexisting conditions, autoimmune disorders, cardiovascular health. 6. Surgical intervention, indications, surgery is rarely needed. Procedure, thyroidectomy, partial or total removal of thyroid gland. Psychosocial medicine. Patients with HASHIMOTO'S thyroiditis may experience emotional and psychological challenges, including 1. Anxiety and depression due to chronic illness and hormonal imbalances. 3. Body image concerns related to weight gain and physical symptoms. 3. Stresses from managing long-term condition. Prevention. While HASHIMOTO'S thyroiditis cannot be entirely prevented, the following measures may help reduce the risk or manage the condition effectively. 1. Regular screening for individuals with a family history of thyroid or autoimmune diseases. 2. Adequate iodine intake through diet. 3. Avoid excessive radiation exposure. In conclusion, HASHIMOTO'S thyroiditis is a common autoimmune disorder that can be significantly impact an individual's health and well-being. Early diagnosis and appropriate management are essential to prevent complications and improve quality of life. A comprehensive approach including medical treatment, nursing care, and psychosocial support is crucial for optimal patient outcomes. Thank you. Have a wonderful day.